Thank you everyone for giving me the opportunity to talk with you today about acute demand management. And also I'm going to link that with the notion of service integration and integrated care. So my brief from Luke was to look at models of care that reduce demand for acute admissions, reduce demand at the front door, at the emergency department, and also readmissions. And also my brief was to make sure it's a personal view and not bore you with a literature review, because there is an increasing amount of literature on this topic. So unlike Frank, I don't have a clinical background. I stumbled into the health system entirely by mistake. My background originally was in publishing, and the first job I got was in medical publishing. And some of you may be familiar with Australian Doctor publication here. It's a newspaper, so I started that here and ran that as the editor for a few years. I went back to New Zealand, did the equivalent there, and then started getting much more interested in what was going on in the health system that all this writing was about. To cut a long story short, I ended up being chief executive of a purchasing authority in New Zealand through the 90s when there was a purchaser-provider split. So I found myself at the helm of a purchasing agency, and then more recently I've worked at Counties Manakau DHB for 9 years, which is in South Auckland, and that's a lot of what I'll talk about today, is that experience. Following that, I found myself as Director of Health Services Planning for the Ministry for a couple of years, and now I'm a partner with Health Partners Consulting Group, which is working with 2 of the 3 demonstrator LHD sites for integrated care in New South Wales. I've also had the privilege in the last couple of months to go on to host a study tour group of primary care leaders looking at integrated care in London and in Holland, and also to attend an international conference on integrated care. So I'll be drawing a bit on that international experience as well in this presentation. So what I'm going to talk about is some trends in integrated care internationally and in New Zealand. I'm going to talk at a practical level about things that we've done in Counties Manakau and elsewhere in New Zealand and the sort of impact that's had, and then I'll draw some conclusions. I should also mention, given that the focus of this session today is on access to ED, that New Zealand's got a national target ED wait times as well, and has had a set of national health targets since 2007. 3 of which are hospital indicators and 3 of which are primary care indicators. So there's been real drive on both inside the hospital and outside the hospital since 2007 around wait times.